My name's Amar. I'm the National Improvement Lead for Mental Health at the Royal College of Psychiatrists, and in my other roles, I'm a clinician and Chief Quality Officer at East London Foundation Trust. And it's really exciting to be with you today to launch this really great new program that we're running on joy in work and well-being. So thank you so much for giving up your time today to join as teams, and for committing to this work together over the year ahead. It's promising to be a really exciting journey together of learning, focusing around what matters most to the people in our teams and finding ways to really connect more deeply to the meaning and purpose in our work, and find ways to really build well-being into the way we work day to day. So I'm really thrilled to be able to kick us off today for our launch event. But I wanted to start really by giving us a chance to just say hello to each other and get to know each other. The beauty of these sessions together are really for us to connect across the teams, 45 teams taking part in this program. So a lot of teams from all across the country taking part. And we want to, as much as possible, encourage people to connect, to share, to learn from each other, and to start building relationships across the community as we do this work together over the year ahead. So we can steal ideas, we can share what's working with each other, and we can help each other learn and work through some of the challenges we're no doubt going to face, as well as the joys of doing this work. So to start us off for today, I wanted to ask us to go into little groups and introduce ourselves to each other and say a little bit about why we're here. Why is it that we've chosen to focus on this topic for our work in our team right now? Why is joy, focusing on joy and well-being, so important to me and to us as a team taking part in this program? So, okay, so for today, we're going to spend a little bit of time just acclimatizing ourselves to how we're going to do this work. And then we're going to spend some time in smaller groups, making sure you feel really equipped and ready to start undertaking the work. I know that many of you will already be meeting and talking about this work and have started some of the early bits of work around appreciative inquiry and starting to measure. And we want to make sure that by the time you leave the session today, you feel really equipped for the next 2 months of work ahead, until we catch up again today in 2 months' time as a whole group. So that's the plan for today. And we've got a lovely story as well to just describe to you what another team has felt as they did this work, and some of the learning that they want to share back with you. 45 teams doing this work together probably makes it the biggest improvement collaborative on this topic anywhere. So a real opportunity for us to learn together and help each other as we do this work over the coming year. But first, I want to just start with a little bit of context around why this work's so important right now, and how we're going to use quality improvement to do this, because I think that's one of the newer elements of focusing on staff engagement and well-being, is really thinking about how we can use quality improvement to do this work. So you probably don't need me to tell you why we're focusing on this topic, or why it's so important to do this work now. With all of the change we've seen over the last 15 months, most of our teams are working differently to how they used to. Some of those changes came in very rapidly, still may not have settled down. There's been a huge impact on people's well-being, sometimes their physical safety, as well as their well-being. Lots of people working way beyond their normal limits over the last year, working in different ways, sometimes outside of their normal bounds as well. Many people working remotely, which means that there's some different challenges around boundaries between work and life. And you know, there really can't be a more important thing to focus on right now than helping our teams reflect on that, think about how they want to work in the future, really making sure they're connecting to the purpose and meaning in their work, appreciating each other and what they're offering each other, and thinking about how we can all support each other and look after ourselves over the coming months. So I think there's probably no more important time to be focusing on joy and well-being in our teams. And when we think about joy, as we'll be learning together, we're not really talking about pizza parties and just celebration. We're really thinking about, you know, what brings us joy in our work. And this is about connecting to why we came into this work in the first place, the bits of our work that really bring us most meaning and connect us to the purpose, and trying to find out what are the things that get in the way of that, and what can we do to start unblocking some of those challenges, and spending more of our time in the areas of work that bring us greatest joy, and thinking also about our well-being, recognizing the relationship between how we are and our physical health and our well-being, and how much we're able to give to those that we serve in our teams. And we'll be learning together about, what the evidence base tells us in this field. We'll be drawing a lot on the Institute for Healthcare Improvement and their white paper. If you've not seen it yet, it'll be a really good thing to read between now and the next time we all catch up together. The white paper brings together the evidence base in this field in a really simple, easy to read way. Now, on the right hand side there, you see the wheel, the IHI Joy wheel, which gives the 9 components that the evidence base tells us are related to people experiencing more joy in their work. And we're going to come onto this in the next of these learning sessions, and really dive deeper into the evidence base and the things that people have found make a difference. And on the left is the sort of 4 steps that they've laid out, which we're applying in the way that we do this work. So really wrapping this work around what matters to people and what brings them joy. Then trying to understand what the impediments are. What are the pebbles in the shoe that sort of detract from our experience of joy in our day-to-day work? And taking a systems approach to this. So really thinking about what we can influence in the way that we work together and in the systems around us to make to help us all experience more joy in our work. And using quality improvement and the systematic approach that brings to help us test out ideas and measure it. So we're going to start with a couple of minutes on just to give an introduction to how we're going to use quality improvement in this work. Some of you may be very familiar with quality improvement, and some of you less so, and that's absolutely fine, because we're going to be providing you support with this every step of the way. So our really skilled quality improvement coaches will be with you every step to guide you and help you take this step by step systematically, and all going about it in the same way so we can learn from each other. For those that are new to quality improvement, really this is what we mean by quality improvement is a systematic approach to working through complex problems. And the key part about quality improvement is it involves those closest to the issue in helping us understand it more deeply and discovering solutions. And then trying those out one by one, testing and learning what works in our setting, and measuring as you go so we can really see what's making a difference. And whether you use any of the different quality improvement methods, you'll always be going through these sorts of steps. You'll be understanding, what it is you need to focus on first, then trying to understand it deeply before you think about how could we improve it, and coming up with some ideas, and then trying those ideas out through some structured ways of testing, and finally figuring out how can we hold on to the things that have worked well and make them part of the way we function in the future. And it's the same in this kind of work. So all of us have already identified that this is the issue we want to work on. So we're already beyond that first step. And many of us are now already into this second step of understanding the system. Before we think about how we want to improve it, we need to have some understanding of the system that currently exists. And many of you will have already undertaken the appreciative inquiry to help you understand the strengths and assets that already exist in your system. What does a good day look like? What contributes to having a good day at work? And starting to collect some baseline data. And I'll tell you about this a little bit more in a minute, but we've asked you to complete 2 validated surveys, the Mini-Z and the Gallup Q12, which we're going to do at the beginning and the very end of the program to see whether there's any difference across our teams at the beginning and the end, and then start to capture data weekly. So the weekly data capture, we want every team to be starting from next week. And it may be that you even want to capture data more frequently for the first couple of weeks, perhaps every day, to start to understand which days of the week might be different, and to decide which days of the week to capture this data on. But if we're all capturing data in the same way every week, it helps us learn from each other and be able to learn from the variation, see where something interesting is happening, and try to figure out what could we learn from that. In the next step that we're going to move on to, each of you as a team is going to develop your own theory about how can you create more joy and connect more deeply to what the meaning and purpose is in your work, and how you build more well-being into the ways that you work together as a team. So each of you will be developing your own driver diagram. This is the fun bit. This is starting to think, what could you do differently? What ideas do each of you have in your team? And the whole team owning this together and coming up with ideas together. As an example, here's one team and their driver diagram. And it's the uniqueness of every single team's theory that makes this work using quality improvement so beautiful, because every team has a slightly different theory about what it will take to achieve the goal. And so for this particular team, there were 4 big things that they wanted to work on: team dynamic, systems and structures, psychological safety, and meaningful work. But that may well be different for your team, and that's absolutely fine. When we've been thinking together about, the sorts of things that we probably all want to be focusing on, this is the sort of program level driver diagram, where when we've brought together a range of people, here's the things that we think people will need to be focusing on. But you will be able to draw on this and create your own bespoke version just for your team, to make sure it really connects with the factors that contribute to joy and well-being in your particular setting, and the things that you think you're going to have to work on. So this we're going to offer to you as our program level driver diagram, but you can make this your own, and we'd encourage you to do that. Once you've got a theory and some ideas, well, you'll be starting to test those using the plan, do, study, act cycle as a sort of structured way to take an idea, run a little experiment, see whether it works, and then to learn from that and adapt it. So some ideas work, some work a little bit, and some don't work at all. And you'll have to take the learning from that and decide whether you want to adapt the idea and try it again, or ditch it, try a new idea. Or if it worked so well, you could take it and run it at a bigger scale. Again, taking an example of another team, here's some of their ideas, very simple ideas, such as working out of the office or trying a running club each week. And you can see how they've used several cycles of testing to test it out. Maybe a running club 30 minutes during lunch one week, but that didn't work quite so well. They needed to make some adaptations. So the second time around, they used an email reminder to remind people about this. Then they tried calendar invites. Then they changed the time to the end of the day, because they learned that lunchtime wasn't great for people, because it meant they spent the afternoon, in sweaty clothes without enough opportunity to shower and change. So testing and learning repeatedly through these structured cycles can help you turn an idea into something that really does work, and everyone owns and feels is a good way for the idea to become embedded as part of the team. We're also going to be measuring every week, and you can see on the screen here the 3 questions everyone in your team will be asking themselves each week. You can decide which day of the week to do this, but every week we want each team to be asking everyone in the team these 3 questions. And we will be collecting all that data, and we'll be tracking it over time so that you can see in your team how you're faring on these 3 questions over time. So as you start testing ideas, you can start to be asking, well, are we starting to see something happen in our data? Are we starting to see signs of improvement? And that will help build your theory about the things that will make a difference. And you may well want to make this work visual. I'd encourage you to make this as transparent as possible in your team. In the days when teams were much more co-located, teams used to use whiteboards in places to make this work visual. But you may want to think about different ways to do that in your setting. But that's a little introduction to why we think this is such an important topic to work on together, and how we're going to use quality improvement as a structured way to work through it together. And I'm now going to hand over to Tom for the next part.
Hello, everyone. My name's Tom Ayers. I'm the director of the National Collaborating Centre for Mental Health. I'd just like to start by really echoing Amar's welcome. We're so pleased to be starting this collaborative. When we were thinking about setting up a collaborative last year, we really thought that we landed on this topic really as one that we thought was, first of all, universal, mattered to every team in the health service, or teams who work with the health service, and but also we felt there's probably not a better time to think about meaning, purpose, enjoyment, ability to do your job at the moment than there is at the moment, given what's happened over the last 18 months in the health service, and for people connected with health care as well. My job, so thank you for joining this today. When we started, we were hoping for maybe 30 teams as a minimum to sort of sign up. So we're absolutely delighted that 45 teams across the UK who are joining this today. My job is short today. So I'm going to start by introducing the program team so that you will all have met your QI coach. But I'm actually just going to, if we could just lose the slides for a moment, please, Emily, and I'm just going to ask them all to introduce themselves. So I tried to do this in alphabetical order in a different meeting yesterday and completely messed up the alphabet. So I'm not going to do that. I'm going to do it from who I see first on my screen. I'm going to start with Renata. If you could introduce yourself, please.
Sure. Hi, everyone. I'm Renata Souza, one of the QI coaches, as Tom has just said, and I'm really glad to see so many people here today, and in particular, my team. So welcome, everyone.
Thank you, Renata. And Saika, please.
Hi everyone, I'm Saika, and just to echo what Renata said, it's really nice to see some familiar faces and also new faces for the QI coaches teams as well. So I'm really looking forward to getting the work started and working with you all.
Thank you, Saika. Matt?
Hi everyone, I am Matt. Being able to do a collaborative on the topic is already increasing my joint work. So I'm looking forward to doing the theme for all of you for the next 11, 12 months.
Thanks, Matt. Kate?
Hi everyone. Not sure if you actually can see me or if I look like I'm in witness protection, but it's good to see everybody here. It's lovely that there are so many of you, and really looking forward to getting this launched and carrying on the work that we've already started.
Thank you, Kate. Emily?
Hi everyone, great to see so many of you, and I echo what all of the other coaches have said. Really enjoying doing this work with you so far and looking forward to supporting you over the next year.
Thanks, Emily. And finally, Dominique, please. Where's Dominique with us? Okay, so another event we can meet Dominique. But as well as the coach, so that's our team of quality improvement coaches who've worked on a number of other national improvement collaboratives, are skilled, and they kind of know how to do this work and work really closely together, and you'll get to know them all, even the ones who are not your coach, over the next year. But the other person that I want to just introduce, who pulls all of this together and is completely, you will have had lots of contact with her already, I think, but that's Christy, and Christy is a project manager for this work, without whom it wouldn't be happening.
Hi, thanks Tom. Hi everyone, it's good to see you all here. Again, I'm really looking forward to the next 12 months of working with you all on this collaborative.
Thank you, Christy. And if anyone's wondering, we've never managed to get Christy to play one of those guitars in a meeting yet. So that is our team. So I was, along with myself and Amar, we're the people who will be supporting you and working with you over the next 12 months on this collaborative. So Emily, if we can just pop the slides back up now. The other thing that I am supposed to be talking about is the logistics of the program, which is wasn't sure what logistics the program meant exactly, but I thought about what are we asking of you? What are the things we need you to remember to do throughout the next 12 months and to commit to, I guess, as well as remember them. So I thought there were actually 4 main requirements that we're asking of you. So the first of those is to attend the learning sets. So the first one of those is today. There's 6 in total, and the learning sets are really where the collaborative often comes alive, where you'll hear stories from each other, where you'll hear ideas you can steal from each other. That's really important, that you steal ideas from each other, and where hopefully you'll be learning and be inspired to do more of this work. The second is data collection. I'm not going to, Amar's taught, or hopefully people know already, but Amar's thoughts and about what the 3 questions are we want people to collect every week, and we've got a bit of a session on that later on today. It's really important to collect the data, because there's no point doing this work unless we know whether it's making an impact or not. We've chosen the measurement plan to be as least burdensome, but enough to be able to tell us something. So please collect that data and encourage all of your teams to do the same. The third is regular contact with your coach. They will help you throughout. They'll do that flexibly. They'll be trying to meet your needs as a team, your needs as individuals as much as they can, but they can't do that if you're not in regular contact with them. So please consider them part of your team, and be in contact with them throughout. But then the final and probably the most important point of this work is, if you don't test lots of ideas, you're unlikely to have the same as much of an impact. What we find is the teams that test more ideas, that try more things out, are more likely to have success in the work. So please spend as much of your energy on testing ideas. Our coaches will help you do that in a systematic way. And really, really importantly, and not just because it's the topic of this collaborative, but actually because improvement work works best this way, have fun. It's supposed to be fun. You can laughter, camaraderie, really important parts of teamwork, the really important parts of quality improvement work as well. So we hope that you enjoy the next 12 months on the collaborative, and remember that it is supposed to be fun and to work with that spirit. So that is all that I wanted to say at this point.